I'm Maggie. I'm a student nurse, and I'm here to talk to you today about your new diagnosis of osteoporosis. Do you know what osteoporosis is?
No, I do not, Maggie.
So it's a bone density degenerative disease where you're losing bone density. So naturally, your bones produce new bone after old bone has been reabsorbed, but in your case, you can't keep up with the producing the new bones. So it makes your bones more brittle. And have you had you had a DEXA exam or scan before?
Yes, they told me my DEXA scan results came back at -2.7, but I don't even know what that means.
So the lower the score, the worse it is. So a -1 and above is going to mean that your scan is normal. A -1 to -2.5 means you have low bone density and are at risk for osteoporosis. And then anything below a -2.5 means that you have osteoporosis. So use the -2.7, which is an indication of the disease.
Is there something that I could have done to prevent this?
Well, yes and no. There are risk factors that are in your control and some that aren't. So some of that aren't is that you're a woman, and women have a higher chance of getting osteoporosis than men do because our bones are more fragile. They're not as thick and strong. And your age, so your highest bone density is at age 30, and after that it all kind of goes downhill. Since you're 75, that would make sense. And then also a family history. Do you have any family history of osteoporosis?
Yes, my mother did have the osteoporosis.
Okay, so that would make sense why you would also be at risk for it. Some of the risk factors that you can control is your diet and weight. So I see that you are 315 pounds, and that extra weight is really going to put a lot of strain on your bones and put you at risk for the disease. I also see that you're a frequent smoker and that you have at least 2 drinks a night. So if you were to cut out the smoking and the drinking, the disease wouldn't progress as quickly.
So if I completely stop the smokes and completely stop the drinks, would it help my condition?
Yeah, it would really help slow the progression of the disease, but also with diet and exercise. You probably are calcium deficient and you need some more vitamin D as well. So you want to make sure you're eating leafy greens, milk, cheese, dairy products to make up for the calcium that's being reabsorbed in your blood from your bones. And you want to just go sit outside to get some vitamin D and make sure you're wearing some sun protection when you're sitting out in the sun.
So if I do all those things, I'll be cured?
Unfortunately, no. Osteoporosis is a disease you're going to live with for the rest of your life, but there are things you could do to slow the disease, like we talked about: losing weight, quitting smoking, diet and exercise.
What symptoms will I experience?
So some people don't experience any symptoms until they start seeing fractures. You could have cephalus, which is curvature of your upper spine, your thoracic spine, which is in the upper part of your back, or you could notice it's like you're shrinking a little bit, you're getting shorter. Those are some common signs of osteoporosis.
Can I get away with just taking some over-the-counter medications?
Unfortunately, no. Some over-the-counter medications are just going to help temporarily, but your doctors really going to put you on calcitonin, which is going to increase, or it's going to reduce the calcium in your blood and some more into your bones because it's being reabsorbed from your bones. And then you're also going to get put on estrogen and Raloxifene and Fosamax, which is going to help with your overall bone health.
Okay. Is there anything I should be doing to make my home safer?
So if you have any throw rugs or anything like that, you're going to want to get rid of those. They're a tripping hazard. You're going to want to put color strips on any steps that you may have, or lights or something like that, and you want to make sure that your house is adequately lit. You have plenty of light so you can see where you're going, because without those would put you at risk for falling. The more you fall, the more likely you are to have a fracture, and every fracture that you have worsens the disease, so we want to make sure that we are protecting you from a worsening of the disease.
Are there any exercises I should be doing?
Yeah, so you definitely want to be practicing some weight-bearing, low-impact exercises. So walking, going upstairs, There's a whole wide variety of exercises that physical therapists can provide to you. You can also take a look at your local senior center or your park district. They often offer classes that are weight bearing and low impact for seniors, but you are going to want to stay away from things like water aerobics, because that's only going to help with your cardiac health, which is good, but it's not weight bearing, so it's not going to help with your problem. So things like Tai Chi and yoga would be a good idea for you to try.
So the best things I can be doing right now is changing my diet, stopping the smokes and drink, contact my doctor about medications we discussed, and exercise?
Yeah, all of the things are going to slow the acceleration of your disease and help you live a much fuller, happier life.
Thank you, Nurse Maggie, for all of your help.
Of course, anytime.